You guys do, okay.
Yeah, so when you're done, it'll save on our, you could download it and what's that?
Do you think it's bad if I keep my,
Do you want, it's
my
recording
lights up?
right now? Do you want to pause the recording?
Sure.
At the Johns Hopkins and talk about the Johns Hopkins report. It looks like that's not going to be ready until January. So that's why we changed the format of this a little bit, but I did not want us to lose momentum. So here we are. What's our next slide, Anne? All right, so we're just going to move right into member sharing. We've asked folks to keep their to focus their topics on what accomplishments have happened to date related to increasing access, tackling workforce issues, and or improving cost for Kitsap County residents. So the first panel that we have is Daniel Palethorpe, Greg Wheeler, and Becky Erickson, who may be jumping on a little bit later. So Daniel, are you prepared to start us to kick us off?
I'll defer to Mr. Mayor. I'll prefer to go second. Go ahead.
Okay. Thank you, Daniel. Thank you, Commissioner Rolfes and Ann for doing all this work to put us together. I'll be brief. I'm just going to focus on a couple construction projects, and I'll cede my time to Daniel after that if there's any left. So here we go. Hold on just a second here. All right, so two large or really major health care related projects in the city begin with the Peninsula Community Health Services Medical Respite Facility, 810 6th Street. And it is just a brief overview, and I'm not sure if the CEO's online or not, and if so, she can kind of elaborate more, but it's a rehab of an existing two-story structure to create 15,800 square feet in downtown Bremerton. It includes 24 respite living units, medical clinic, training rooms, and office space. This plan contains 2,300 square feet of rooftop deck amenity area, new parking area, and landscaping. The next project, primary project we're working on is CHI Common Spirits, freestanding emergency department, 4205 Kitsap Way. It's 11,245 square feet of renovation, and that remodel includes office space, examination rooms, radiology, ambulatory facilities. And just a brief update where we are, the building permits are under review for each project, and we hope to have those issued in the near future. I just thought I'd focus on those. Obviously, there's several programs that we support in the city. They're ongoing. Before this year, when we undertook this specific mission, collaborative mission together. But I'll turn my time over to Daniel. That's okay, Commissioner Rolfes.
That's great. Thank you for that update. And we do have Jennifer Kreidler, who should be on in a couple of panels, so we can get more details from Jennifer.
Yeah, and CEO Chad Melton. Thanks.
Chad also.
Yep.
Okay, Daniel.
Good afternoon, folks. I'm Daniel Palethorpe. I cover Kitsap County and the Olympic Peninsula and Thurston County for Senator Patty Murray. I will also be pretty quick. I guess what I'll first say is that unsurprising, this is an issue here in Kitsap, but also across the region, particularly up in Jefferson and Clallam counties as well. And so I think that where there are opportunities to partner between counties and between communities is wonderful. I think the event earlier this week at Olympic College is a great step in the right direction, and excited to work with Marty and the folks there about what might be possible moving forward. I don't have a lot about what we've been able to deliver this year, but I will say that I've been chatting with folks locally about what opportunities for federal funds might be possible, and trying to be creative in the next months and years to try to get those into Kitsap. I will say specifically the senator and our office is working on a letter regarding the reduction of services at the Naval Hospital and seeing what might be possible there. We're partnering with Representative Kilmer, unsurprising to many of you on that, because I know he's been very involved. So nothing is set in stone yet, but we're hopeful to be able to improve the situation there and then ultimately help out the entire community. So pretty short today. Thanks.
Okay, is Mary Erickson here, Anne, or will we pull her in a little later?
We'll have to pull her in later. She hasn't arrived yet.
Okay. All right. And again, if you have questions, put them in the chat and we'll see, we may have time to get to them. So our next panel is our healthcare providers. So why don't we start with, let's go in the order in which the faces appear on the slide. So we'll start with Chad.
Thank you. Thanks for having us today and coordinating this meeting. Always look forward to it. I think that as you go through the presenters today, you'll probably hear a lot of similarities in projects, because I think the past year has been really about collaboration and building of relationships and partnerships to make sure that we're meeting the needs of the community that we serve. And so we talked about, and Mayor Erickson will probably talk about it too, is that when we went into this discussion, we talked about access and no way to create additional access points without workforce. So it has been our primary goal. And as it was mentioned, we did that kickoff earlier this week on Tuesday about the partnership and collaboration with the county, with VM Franciscan, with Olympic College to create new programs at their Paulsbo campus. And so that's one way in which collaboration relationships really work. The other thing I'll say about workforce is that ongoing work as well about how do we get phase 2 off of the ground. A lot of collaboration with the STEM programs, local high schools, about how we can create those career pathways. So meetings underway. So if we set up another meeting, I guess that is that success. That's what I was told earlier in my career. So progress continue to be made on what that's going to look like longer term. Other things that we did this year is that we're graduating on next Friday, another class of residents. So 24 nurse residents will be graduating. We are doing our best to try to get nurses into the program. And we have gone from 2 classes a year, and starting in January, we'll go to 4 in order to make sure that we're bringing residents on, not just with their graduation dates, but also throughout the year to make sure that we can continue to bring staff members on. Success for us is that we were able to drop our turnover rate for nurses from 18% to 10%, and overall also overall staff turnover from 23% to 15%. So a lot of cultural work has been done here at the hospital locally. So that's kind of the workforce aspect. And since I have only 5 minutes, I'll speak faster. Other projects that we've recently announced, so the new tower. So we really appreciate the county commissioners and Kitsap Public Health collaborating to make healthcare a priority. And so we announced the new tower. And from my understanding is that it's moving along much quicker than in the past. So thank you all for the work that you've done to streamline the permitting process. We hope to start groundwork early on in 2024, sometime in the late first quarter, early second quarter, with a goal of completion within about 18 months from the time that we start the project. And that'll create additional 74 beds here within Kitsap. The other thing is that emergency room numbers continue to grow. So we're on track to have grown the ED volume over the past year by about 9%. And knowing the growth that's here locally, we announced, as Mayor Wheeler said, to do the freestanding emergency room in Bremerton off Kitsap Way to help fill that void. And so we're doing those pieces as well. And then we do have plans for a second location within Kitsap that can't be announced yet, but we hope to be able to do that in the very near future. Lastly, I'll just conclude that ongoing collaboration in regards to not only access, but decreasing overutilization. So currently collaborating with our partners at Kitsap EMS, and so Paulsbo and South Kitsap and others, about how we can help grow and support the CARES programs long-term, which I know that Chief Gillard is on the agenda, so I don't want to steal his thunder. So I think that you've heard today just about the collaboration, relationships, and partnerships. So those are just a few things that I had for this group that were success. Many more, but time does not allow for me to cover it all. So I will pass the baton.
Chad, as the facilitator, I'd like to give you a couple minutes extra. And I am keeping my eye on the clock, as I know Anne is too. There are 2 questions. Can you speak to the demolition of the old hospital, kind of the timeline for that? And two, can you tell us the timeline for the urgent care program to open?
I sure can. Thank you for the prompting. So the old Harrison Hospital, we had to transition all of our IT infrastructure out of there, and that's why it took so long for us to begin the process. But as of November, we are fully out operationally. So there's no more. We're no longer operating. We handed over to the construction team. And so they're in the abatement process for lead, asbestos, and other things. And then, as I discussed with the team earlier this week, the building physically should start coming down in January timeframe. And I was asked last night at a chamber event, is it going to be a big explosion, a large ball? And it's none of the above. It'll be taken down piece by piece. And so we right now the timeline calls for that building to be greenfield as it's going to get in September of 24, unless something else happens that delays the timeline. And then the freestanding ED urgent care, our goal is it really depends on permits, but right now we've had to shift the date. So we're looking at late second, early third quarter for the freestanding emergency room.
Hey, thank you. Catherine, are you ready?
I really am. Hi, I'm glad to see everybody today. I'm Catherine Mahoney. I work with Chad. I'm part of the Virginia Mason Franciscan Health regional team, focusing on government affairs and public policy. And we have a lot, as we mentioned, the focus from the Johns Hopkins study. Obviously, there's a lot of conversations about policy in our area. So I wanted to talk a little bit about the stuff that's happened in 23 and what we're going to be focusing on in 24 to help deliver more access in Kitsap. So looking back, we're really excited about the partnership that we've struck with the Morehouse School of Medicine. This is a statewide, a VMFH-wide partnership, but we will be bringing in third and fourth year medical students for rotations throughout communities in Western Washington, including Kitsap. The goal here is to increase the number of Black and Brown doctors serving our communities so that we can have a more reflective physician and provider makeup. We're really excited about showing these Morehouse students what it looks like to get to live in and work in Kitsap. Along those lines, I wanted to make sure that everyone was familiar with our family residency program that we operate out of our Bremerton Family Practice Clinic. Got to have Mayor Wheeler out earlier this fall to take a look at what we're doing in that clinic. We have 24 residents at a time there. Our current class that we're looking to graduate in next year, 75% of them have signed on to stay in the area. And as we're talking and matching with other residents coming in for the next class, already half of them are saying, yep, this is where I want to be. So these are family practice, primary care physicians that we are investing in and growing and keeping in the Kitsap, greater Kitsap community that we're really proud of. The residency program in the clinic there in Bremerton serves over 55, almost 6,000 patients, is about how big the panel is. And this is family practice resources. So this is, birth through geriatric, preventative care, prenatal care. We bring in specialty services, like we have an HIV clinic on Fridays. We can do minor procedures there, everything from, minor dermatology and vasectomies and IUDs and biopsies to support further investigation on illness. And it's a really growing and pretty cool clinic that we're proud to be operating there in Bremerton to meet some of the primary care needs in Kitsap. So lots happening there. That's pretty exciting. Also wanting to flag the change in our charity care policies and law that we were able to help get through the legislature a couple of years ago. What this means that there's a much more transparent and consistent way that healthcare providers across Washington state are providing charity care opportunities to our patients. what that means for St. Michael is that we know exactly how many applications and how many of those completed applications we were able to meet the needs of, and we're reporting that quarterly to the Department of Health. So I just wanted to share with you that so far for the reporting that we have through 2023, we received over 1,700 in the first 2 quarters of 2023, 1,705 applications, and of those, over 1,600 were eligible. It's a rate of 95% of applications that are meeting the eligibility requirements of the state for charity care. So we're proud that we continue to be able to increase access in that way as well. And then finally, I want to talk a little bit about looking forward to 2024, the short legislative session, because there's a couple of big opportunities that we're working on that would have significant impacts for Kitsap. One of those is a Medicaid rate increase for providers. So we know, and especially in our conversations that we've been having around prenatal care and OBGYN support in Kitsap, that low Medicaid rates is a real problem. So the Washington Medical Association has been leading on establishing a revenue source to be able to increase Medicaid rates for our community providers. It's going to be a tricky legislative feat to pull off in this session, but we're throwing all of our weight behind it. It would work as an assessment on insurance companies. They would pay a per head assessment, and then the state would be able to take that assessment and draw down a lot of federal dollars. And so it's a budget neutral to the state, and it's able to get our providers something closer to Medicare rates, which is more sustainable, especially for our smaller, more rural practices. So we'll be working really hard alongside physicians across the state to try to get that done this year. It will be significant. Another thing that I wanted to flag, 2 more on the policy side. We've been working with former Governor Gregoire and her Challenge Seattle civic organization to come up with some plans for how we can make significant improvements through policy and funding this year on ED utilization by chronically unhoused folks, especially those demonstrating behavioral health and or substance use disorder issues. And so this is a very fast moving project. The former governor sprints hard when she sprints, and she's already working on getting some commitments from legislators on how to help build up more quickly both beds for SUD purposes, as well as more street medicine and other things along those lines. So Virginia Mason Franciscan Health is going to be working really hard to try to deliver on those suggestions coming from the former governor this current legislative session. And then finally, St. Michael Medical Center is approved by CMS and the feds to be able to operate what's called hospital at home. Hospital at home is when we're able to give and deliver hospital level treatment to people in their homes. This is something that has been, we're piloting now at St. Joe's in Tacoma, and we'd like to be able to operate it at St. Michael as well. But we can't until we pass a bill. And we actually have to get it done this year. So we'll be focusing on working with the Department of Health and with our legislators to make sure that we get that over the finish line so that we can start growing that program in other parts of Washington. It's really cool. Would love to talk to anybody who's interested in it more, but it's really meeting patient needs, and the quality measures are really high. Readmit rates are really low. And it's something we're really excited about trying to grow and deliver as an opportunity in Kitsap as well, but can't do it unless we get a bill passed. So those are the things I thought this group might be interested in around that kind of affordability and access.
Thank you, Catherine. We're Anne and I behind the scenes have changed the rules a little bit. If folks want to place a question in the chat, Anne will read them at the end of each panel, and we'll facilitate a small Q&A after each panel is finished presenting, and then we'll move on to the next panel. So Anne's going to be monitoring that. Jennifer.
Hi, I'm Jennifer Carther Moss from Peninsula Community Health, for anybody who doesn't know me. I decided today that I would give you guys an update on our housing projects. If you don't know, Peninsula decided to get into the housing game. The why behind that is we actually screen all our patients in all their medical visits for what they identify as health harming needs that involve social type issues, social, emotional, legal, that kind of thing. The number one need our patients have been identifying for the last 18 months is actually housing. And for a long time, we didn't think we could do much with that other than refer them off to our housing partners. That being said, we did decide we were going to try to help figure out some housing. So we have a board of directors who's super supportive of filling gaps in the community. That's generally what community health centers do. So we started small, and our first housing project actually will come online right at the beginning of the year. We have a house we call the Cedar House. It's on 5th Street. It's an older, really pretty house that just happens to be between a parking lot and an apartment complex. It's right behind the health district. It has 2 units in it, which we were successful in obtaining project-based vouchers from Bremerton Housing Authority. And so we will be opening those units up for our first housing clients right about the beginning of the year, probably February. We just had our permit issued in the last 2 days. We had to do some minor remodeling work, and we will be on our way. So that's our first project. Our second project actually was a project of opportunity. We purchased what is known as the Sage Apartments. It's over by the old Harrison Hospital. It was that half-built project that was stalled. Here's a word of advice: don't ever buy a half-built project. We bought it from bankruptcy, and we learned a whole bunch about what it is to buy a project in bankruptcy. But it's been fun, and it's been a great learning experience, and we're super excited about it. We are using that for workforce housing. If you don't know, we actually run, due to workforce issues, we have several apprentice programs that we run. We make our own MAs, we make our own DAs, we make our own behavioral health techs. Those run us a significant investment in dollars and resources to do that, but we just literally couldn't find anybody to staff our programs. When we do that, we find in dealing with our own staff that they have problems finding housing, as does everybody in Kitsap. We are a second chance employer, and a lot of times find that what our employees have problems with is coming up with first and last deposit, escalating deposits, that kind of thing. They're great people. They just kind of need also, just like we find for our patients, sometimes they just need a little extra support to kind of get moving down life. So we have 29 units set to come online right at the end of April. Not only are we learning how to do housing, we are learning how to do staff housing, which is also different. We do get asked what happens if they don't work for us. If they don't work for us, they actually will not be eligible for continued housing. It is just the reality that if we turn that into regular housing, it clearly won't be staff housing in a very short amount of time. And our whole point with going with workforce housing is to kind of work upstream to our problem with trying to make sure we have enough staff to actually serve the community. Peninsula sees 40,000 distinct patients every year across all our program lines. And so we're trying to stabilize our workforce a bit, since we just simply can't compete with some of the other agencies as far as wages and benefits. So we see this as one of our added benefits. We have added a bunch of benefits that does come up. We do pay tuition assistance, we pay loan repayment. We have 2 cool, super popular benefits. We pay for the YMCA and Costco. People love that. So, we try to keep local creative benefits as well. So housing is in our bucket for that. We're figuring out how we're going to allocate that housing lottery system, but so in a short amount of time, we're figuring that one out. Our third project, Mayor Willard touched on, our medical respite center is known as Willow Center. It does have 22 units for medical respite, picture like a dorm room. It's a single unit where people can recuperate who would otherwise be homeless or housing unstable for up to 30 days at a time. It is not longer than that because that triggers landlord tenant. People can be readmitted, but it is a short stay idea to help them not stay in shelters, which may be above the shelter staff for medical ability, or in the hospital, which may need those beds for something more acute. We have 2 housing units actually inside the medical respite center as well. And that's for our staff who will be there 24/7, 365. They're not clinical staff overnight. They are just trained behavioral health type staff to deal with issues, safety, that kind of thing. As Mayor Willer says, it does have a medical clinic. Patients will be seen every day for medical needs. It will have optional behavioral health services that patients can opt into for both substance use and mental health. Right now, that's scheduled to come on. It could be finished being built by November of 2024. We are also waiting for our permits to come through, and we're waiting on a grant to clear us to start. So I honestly think that'll probably be an early 2025 start at this point. And then our fourth project, if I don't think a lot of people know because we've only owned it for 2 weeks. We actually own what we call the Hemlock House. If you don't know what house that is, it's the one directly across the street from Medical Respite. It was a house owned by John Hoffman. It was a high crime house just 10 minutes ago. The sheriff has evicted the last of the squatters. We're actually going to put a sign up that says future home of Peninsula pretty soon, just so people know who owns it. We have it boarded up right now. We have had it looked at and it will be torn down. It is not in shape that it can be rehabilitated for a reasonable amount of money. We are going to put in for an Apple Health and Home grants. Peninsula is largely out of capital dollars that it can invest at this point. We did not get any money on the SAGE project, our workforce project, so that's cost us about $8 million at this point. So if we can get money for the Apple through Apple Health or other grants, we are looking to put at least 16 units of permanent supportive housing directly across the street from the respite program, which we think is a great fit for that house, and an honor to John Hoffman, if you don't know him, who was a big-hearted kind of guy who took people in all the time. And so that is our project. That's our newest project. It's 2 weeks old, and so we're figuring that out. So that's the state of housing at Peninsula.
That's a lot, Jennifer. Congratulations. And thank you. Zach, are you ready?
I am. Thank you, everyone. I'm happy to join this group and hopefully to continue learning what this group is interested in to kind of refine as we go forward. But Multicare is continuing to expand in Kitsap County. I believe right at the end of summer or right at the start of September, we launched our home hospital and hospice program in Kitsap. The numbers are, as the program's growing, relatively low, but we continue to bring more patients and being able to provide care to people in their homes. So that program is going to continue, and we're continuing to push forward, as Catherine said. That is an issue coming up in the next legislative session to make sure that program can continue receiving the funds that the program needs to sustain. We're also continuing work on our Bremerton off-campus emergency department, or a better name for that is the neighborhood emergency department, a little nicer sounding. That is currently stuck in permitting right now, but we still hope for a opening in 2024, looking at probably the second half of the year. Also with Multicare, as Jack sort of talked on before, we're also doing work around on reducing staff turnover rates. For the system-wide, we had about 23% down to about 18% annual turnover rate for non-physician providers. That number is very similar to our Indigos and home health agency in Kitsap. This was work around this kind of culture, listening to staff, figuring out what the needs are. Particularly, hey, is it parking? Is it lunch breaks? How do we figure this out and how we continue to build? So Multicare is continuing to listen to staff and continuing to help improve this, even day-to-day things in the workplace to make sure that staff are feeling valued, as well as have the supports they need to provide care. And with that too, for bringing on new staff, Multicare has reduced our timeline for onboarding, where before between an interview and a job offer was about 4 days to 5 days to a week. We're down to a single day turnaround. So we're able to bring staff on faster, get them into the process, and get them seeing as patients as fast as possible. And then also just kind of looking into 2024, Multicare has continued to expand our LGBTQ plus care. We made some changes recently around our electronic health records and physician training to be more trans inclusive, as well as inclusive to the entire community, with working with local community partners to help build support networks. And even though this is a system-wide area, we're continuing to expand it in Kitsap and making sure that LGBTQ youth and the whole community is getting the care and that's the community that they need. So that's all the only update I had. Happy to answer more. any questions, but I'm looking forward to this being a part of this group.
Thank you. And Zach, your urgent care center or clinic is in East Bremerton. Is that correct?
Yeah, I believe so. Yeah.
Okay.
Yeah, for the off-campus emergency department. Yeah.
Yeah. And do we have questions from the chat?
Yeah, we do. And just to let everyone know as well, I just opened the chat so you can chat with everyone. So as we go along, if you think of another question, panelists might be able to just answer those directly in the chat, but I'll read a few that have come in so far. The first one from Lenny was, is anyone working in partnership with UW School of Medicine to create scholarships for medical students who are from Kitsap or the Olympic Peninsula and would be interested in returning here as primary care physicians? And she was referencing the Yakima Valley Scholarship, which is honoring Paul Ramsey as a model.
So Chad, you unmuted. I'll let you all unmute yourselves to answer that.
Catherine, you certainly can. No, we don't. Oh, no, we don't utilize the scholarship programs at this point in time, but that's part of what our residency program is is they keep people local. A lot of their residents are from the area, want to be in the area, and we have an extremely high retention rate. So our first class we retained I think 100%. The second class not as good, about 40%, and then this next cycle where I think there are 2 people who left the program, but they were going to go on and do fellowships. So instead of doing scholarships, that is our way of doing it through the family residency program. And then earlier this year, we also started general surgery residency program here locally, and that'll be the goal of the program with Morehouse College too, is to bring them here, find them residencies here within the community, and keep them with us long term. But we are looking at scholarship opportunities with OC and other local colleges for staff level positions, not just providers.
So no scholarships directly to the UW Medical School for first year medical students, but providing the support through the residencies. And Jennifer indicated that was the same system they use. Catherine, you had your unmute. Did you have something you wanted to add?
I was just going to reiterate that, you know, the real key for us is to try to attract residents. Like that's where we see the ability to actually, that's the last step before folks are really fully serving. And so we're really interested in continuing to grow residency and attract residency, including convincing local folks that they would like to become doctors and come back and match and do residency in the community. But we'll look into the UW piece for sure.
Thank you. And Catherine, before we leave you, there are a couple of quick questions. One is, what is the legislative bill number for the hospital at home bill?
It just got sent to the code revisor yesterday, and we're still answering a couple of questions that they have. So I don't have a bill number yet, but I can tell you that it's going to be sponsored by both chairs and will be bipartisan. One of our legislators in the 26th, I think actually all 3 of our legislators in the 26th will be signing on to the bill. So a lot of support, and I believe both in the 23rd as well.
So the chairs for Carolyn, so she can track it. You mean Annette Cleveland in the Senate and Marcus Riccelli in the House?
That's right. That's right.
Okay, thank you. And Jennifer, thank you for answering the question in the chat about residencies for pharmacists, dentists, and psychiatric nurse practitioners, and for support staff, tuition assistance for any field related to our work. And Jennifer, there was another question for you about the rent for the Sage apartments.
Yeah, we're working with Bremerton Housing right now to assess the rent range that equals fair market value. And then we will still use fair market value, but our plan is to skew to the lower end. We know that a lot of the rents in Kitsap right now are not fair market anymore. They're inflated market. So our plan is to stick to fair market, but aim low. And then to allow staff to build up their deposit. So we don't think we're going to do first and last and all that. We're just going to retain a deposit for reasonable damage. And then that's our plan.
Let's see, there was a question for the county related to permit backlog for multi-care. And Zach, I don't know if you've been looped in on this, but I know that we've actually expedited the permits for the healthcare facilities. So I believe in my last communication with multi-care, everything was moving forward. And I'll ask Zach if perhaps, I know Ingrid is not here today and my communication has been with her, so I'm not sure, Zach, if you're aware of anything to the contrary.
No, that's what we know. Just I think it's just at that tail end of that permitting right now. So hopefully get shovels in the ground starting next year.
Great, thank you. Okay, and I see, thank you, Catherine, for answering the question about a little more detail on hospital at home. Thank you, everyone, for using the chat. And I believe we have one other question from Lenny for the group. Are there community-based organizations or community care hubs working with local providers of healthcare to Medicare patients to implement the new fee schedule available in 2024 for addressing health-related social needs? Anyone would like to?
I see a bunch of blank stares. Lenny, do you, Anne, you have that question, so we can do some follow-up on that.
Yeah. Okay, we'll do that.
Yeah, well, it sounds like first we need to know what the 2024 new standards are. So we'll get back to you on that.
And let's see, and then Susan had a question about also bill number for the Medicaid bill, Catherine, that you referenced earlier in your
It's
update.
likely to be mostly a budget item, and I'm unclear if they're going to have an actual policy, but I will be keeping Commissioner Rolfes and the rest of the commissioners and staff up to date on it because it's a pretty important piece of policy.
And I had asked Daniel that question earlier before the chat got open about whether the federal government whether we'd be seeing increased reimbursement on TRICARE or any of the federal rates. And his answer was no changes yet, but still working on it.
And then one other question from Monica Bernard. Are there opportunities to incorporate training for behavioral health workforce in the new OC Healthcare Campus offerings?
I want to ask Chad that question if you know the answer to it. There is a pretty extensive list of training, but I don't know if the behavioral health component was part of that. Do you know, Chad?
Monica, are you referring to like behavioral health techs or nurses? What do you?
I was thinking along the lines of behavioral health techs.
Yeah, not that I saw specifically on that list. So I don't want to speak fully for Alicia or Marty, but there was a survey sent out about a year ago to the community in regards to what were the greatest needs. I'm sure Alicia would be happy to work with you on that, but as far as I know, did not make phase 1 or phase 2. But doesn't say that it's not a need or something that they can't do. I think we just gotta put it on the radar for them.
Yeah, I don't think it was part of the identified needs, but it really, really would be very useful in supporting the work that we do here at KMHS. So I'll talk with Dr. Nye.
Okay. Yeah, and I would just be clear too that the programs are not specifically for us, and so it was meant a healthcare need in the community as a whole. So Jefferson, Olympic, others were also surveyed to see what their greatest needs are, and that's how the programs were prioritized.
Sounds good. Thank you.
Yeah, and I deferred that to Chad simply because he's been in some more of the meetings than either I or Anne have been at this point. So thank you for taking that, Chad. Anne, are we ready to move on? Or
I believe we are. If anyone has another question that I missed, I apologize, and feel free to unmute yourself and you could ask that as we're transitioning to the next panel. And Mayor Erickson has joined us, so I am going to add the mayor to this next spotlight.
Okay, and we are doing great on time. So we have four more speakers organized. So I think this Q&A after the presentations is working well. All right, Mayor Erickson, thank you for joining us. I'm going to start with you. We were looking, well, you were on the first panel with elected officials. So with Greg Wheeler, it's okay, Greg Wheeler and Daniel Palethorpe, and really we're just looking for brief update on what Paulsbo may be working on that you want to share with the broader healthcare continuum of healthcare working group. And Chief Gillard is joining us to specifically talk about CARES. So hopefully he's going to pop on. So you can do a brief overview of that, and then hopefully he can help us with specific questions too. So welcome.
Multifaceted approach. We have our division of Housing, Health, and Human Services that has been very, very busy looking for better healthcare access, but also concentrating on vulnerable population addiction recovery. The big news of the day, of course, is the announcement of the Olympic College expansion. In my initial conversations, I remembering 13 different disciplines that will eventually be offered at the campus. This is really just the first phase. There will be an additional phase where actually a new building is supposed to be built. It's a big deal for all of us, the entire peninsula, to be able to train people that are really needed in our healthcare professions. And so it's been a long time coming. We've been working on this for the better part of a couple years, and so I'm deeply appreciative of Chad and Marty Cavaluzzi, Elisa and I, the whole team of people that were involved in putting these pieces together. And so I think that the next critical step is, believe it or not, is the Johns Hopkins study that will be released by the health district at the end of this month. It's public this month, isn't it? Or is it public next month? But it's coming out very, very shortly. And what I'm hopeful for with that particular document is to really detail out where our shortages are and where our barriers are for healthcare. What are we missing? It's pretty hard to fix a problem you don't understand. And I think we all know that the healthcare delivery system is a very complicated thing. And so I'm very hopeful with Johns Hopkins and the study that they will kind of detail out some roadmaps and some, implementation steps that we need to take in order to alleviate what shortages might be out there. So taking that document and looking at it carefully towards next steps of things we need to do. It was very apparent, though, at the very beginning, when I first started delving into this, actually a long time ago, the shortage of trained personnel. So the OC thing, and the use of the campus started back more than several years ago. And we're deeply appreciative of that development. The other thing that we're doing here in the city of Paulsbo is working jointly with our fire districts. Paulsbo Fire, Chief Gillard's on, I think. He can go in more detail about the specifics of the CARES program, but the grant funding for CARES initially came through the city of Paulsbo for Paulsbo Fire. Paulsbo Fire is now absorbing that. Now we have an additional grant source for Central Kitsap Fire for them to start their CARES program. There's a real hope that I have in the next several years that we will have CARES access, which is EMT services for our vulnerable folk throughout the entire county. That's kind of the goal. I know that South Kitsap Fire District is very interested in moving forward as well. So we've generated the grants. In other words, we found the money, did the work to get the grants, and then we give the grants to the fire districts. So I'm hopeful that we can get that going throughout the county. The third thing the city is doing is we opened our recovery resource center, which is a very, very important step to deal with mental health and addiction. And because they're often commingled, right? They're co-occurring. And that opened last month. It's starting to really take off. I think we had 4 or 5 people show up just yesterday, where it's getting a lot of activity. We're partnering with about 14 different organizations to provide services for those people that are dealing with addiction or mental health challenges. This came about because of the change in the law, where we don't want to put people that are addicted in jail. It doesn't make a lot of sense. But when possession became a gross misdemeanor, what we're trying to do is diversion and getting them into treatment. But it still has some teeth to it. In other words, if you don't follow the rules, you can end up in jail if you don't seek treatment and you don't follow through. It's the recovery center is on a membership basis, which is you show up and then you make a series of commitments and become a member of the center, in order so that and you're attached to peer counseling in order to help through the recovery. This was developed with the City of Paulsbo, City of Bainbridge Island, and the Kitsap County Prosecutor's Office are all involved with this particular center. The next step, which we just talked about yesterday, is something called recovery housing, which is, it's one thing to treat people for addiction and mental health co-occurrence, but they have to have some place to live. They have to have some place where they can go and stabilize their lives. And that recovery housing is combined with employment training. And so that will be the next step that the city will head towards, which is actually having houses that are not sober houses, but there will be some treatment that will go on in the houses, but we need to have housing for people that are going into recovery. So that's the next piece. And then finally, the fourth piece is, once again, recruiting more medical care, period, however that looks. Well, welcoming other practices into the community, and trying to be as supportive as we possibly can as they arrive. I keep hoping for UW Medical. They have a sign on the building that they're there. Fred Hutch Cancer has expanded and taken a whole floor of a very large building in Paulsbo. So they're expanding, and there is space for UW Medical, and I keep hoping that we can entice them to come our way. There is plenty of need for all kinds of medical care in this community. My hat goes off to Virginia Mason and what Mr. Melton is doing down there. St. Michael's is doing very good work, but we need more and more. And so I keep looking for other medical providers to come into the community. And I think I've just talked for about 5 minutes straight, so I'm going to be quiet now.
No, for such a little town, you guys are doing so much. Thank you for joining us. Let's move on to the fire chief from Paulsbo. Gotcha.
There we go. Sorry, I'm still learning this whole Zoom thing. Mary Erickson covered some of the parts of our CARES program, but I'll talk a little bit about what's going on in the rest of the county. So in 2023, we saw the expansion of the CARES program from just Paulsbo Fire, which was providing service up into North Kitsap and Bainbridge Island, expanded into Central Kitsap. So they had their program running for most of 2023, along with East Jefferson Fire and Rescue also started their CARES program, which has been a great expansion of the programs to more of our community. And we were also able in 2023 to more formalize our relationships with our substance use disorder professionals, and also were able to implement a very formal fall prevention program that our medical program director was spearheading. 2024, we really have some big sights for 2024. Mayor Erickson already alluded that we are on track for South Kitsap Fire and Rescue to implement a CARES program in 2024. We're going through the hiring process for their social worker and trying to support them the best we can to make sure their program can get off the ground. And even more exciting, I think, is the work we've been doing with St. Michael's and President Milton to embed physician level providers into our CARES programs that will be able to really deliver real, true mobile integrated health out into our community. The idea that we could pair a firefighter doing EMS work and prevention type work, a social worker linking folks with resources they need, and an actual physician or nurse practitioner to solve some of the medical care issues is just, it's so exciting that we're going to be able to deliver this service to some of our most vulnerable people in our community. It is a huge undertaking, but I'm really excited about the services we can provide. So a couple of the metrics for 2023, just so folks can understand what we're doing. Between Paulsbo and Central Kitsap, we saw 681 total community members that our team serviced. And one of the more compelling metrics about the impact they're having on folks' lives, we have been keeping track of the number of 911 calls and ED visits that these community members make for the 3 months prior to our CARES teams getting involved, and then 3 months after the CARES teams have been involved. And we've seen a 75 and 66 to the two different agencies decrease in the frequency of 911 calls. And this is also really exciting, a 65% decrease in the number of ED visits for all of those folks. So they're making a real difference in finding people the resources they need to prevent future emergencies, which is why they're out there. And I wish I had more time, because behind those metrics, it is so encouraging when I get to talk to our CARES teams to hear some of these just absolutely amazing stories of being able to connect community members who are relying on the 911 system, the fire department, and the emergency department for medical care. And our CARES teams being able to find what's the cause is and link them to all the great community resources out there. And they have made some just absolutely amazing differences in people's lives and stopped a lot of medical emergencies. And I know that they've actually saved some lives out in our community. And this is all made possible largely through grant funding still. Unfortunately, we're still having to spend a lot of our time and effort pursuing the grants. We had a ton of help from the city of Paulsbo that really was responsible for getting us involved in this. But we are constantly tracking down grant funding, which is a huge challenge. But we've been very well supported by Kitsap County and Salish Behavioral Health and some other agencies. And in the future with St. Michael's and their program, it's just relying on those grants isn't a great long-term solution for this. But that's kind of my report out on our CARES programs. And I am excited to hear what your questions are.
All right. Thank you very much, Chief. Kate, are you ready to give us an overview?
I am. Can everybody hear me okay?
Yep.
Yeah, perfect. Well, good afternoon, everyone. Kate Mundell. I am the Senior Director of Provider Engagement and Community Relations for Coordinated Care, one of the 5 MCOs, the leading marketplace plan and Medicare Advantage plan here in Washington. I've worked with many of you in that capacity, but just wanted to share just a little bit about what we've done and what our plans are through those 3 lenses of access, workforce, and reducing cost. So from an access perspective, I mean, we're the supportive cast, right? The provider-patient relationship is the heart of healthcare. We're part of the supporting cast on the payer side to make sure things go right and go well and things get paid for and that there's access to that care for our members. So growth has really been the name of our game to increase that access and increase that path forward. Of the 39 counties in Washington, Coordinated Care has a footprint for foster care, where we're the sole source MCO for foster care and Medicaid of all 39 counties. So for foster care and Medicaid, we are statewide for Marketplace. And as I mentioned, we're the leading marketplace product on the state-based exchange. That's Better by Coordinated Care. For 2024, we've done the work to land in 33 of the 39 counties. And then for WellCare, which is our Medicare Advantage line of business, we will be in 34 of the 39 counties next year. So growing our footprint, growing our access, and then partnering with key provider groups. Loved hearing from VMFH and PCHS today. Contracting with those providers, partnering with those providers, that's the name of our game. The heart of healthcare. We're just here to support and build the network and adequacy so that our members and our communities can have access. So that's a peek into the lens from an access perspective. From a workforce perspective, we take our supporting cast role very seriously. Over the past 2 academic years, Coordinated Care has invested over $500,000 in community scholarship efforts in order to grow the workforce that will drive that heart of healthcare, that patient-provider relationship. So we have made scholarship awards to over 20 institutions across the state, beginning in the 2021 to 2022 academic year, and then last year, and then now again this year. Close home to the Kitsap region, we did support Peninsula College. And last year we got success stories from 9 students who we were able to make a difference in supporting continuing their education in the healthcare sector. And then we have made awards again to institutions all across all across the state, and we'll continue to do so as the years move forward. And then in the improving cost arena, I would actually maybe switch things up a little bit, and I don't know how much of a floodgate I'm opening up here, but I would offer up, please put in the chat how we can help. From a payer perspective, it really is, how can we reduce the administrative burden on providers? How can we partner with community-based organizations to, increase access to medically tailored meals, or blood pressure events, or medication. And so again, from a supporting cast perspective, we've done a lot over the years to make a dent in reducing that administrative burden that any payer could potentially put on a provider or a partner, but would really open up as an MCO, as a marketplace payer, as a Medicare Advantage plan. How can we help, and what more can we be doing to supporting the Kitsap community?
Thank you. And we are going to round things out with Susan Brooks Young, who's been working in the community to gather information and come up with ideas. So Susan.
Thanks very much, Christine and Ann. I appreciate being asked to share with all of you today. Just as an introduction, the Alliance for Equitable Healthcare is a county-wide grassroots group that formed 2 years ago by residents of Kitsap who represent a wide range of backgrounds and experiences. What brought us together was a common goal to identify strategies to ensure that everyone in the county has ready access to affordable, comprehensive, and equitable health care. In the past year, we've been engaged in a variety of activities, and just a few include, first, hosting a free screening at the Bremerton Roxy of the documentary American Hospitals, Healing a Broken System, which also included a follow-up Q&A, organizing listening sessions around the county in which attendees are invited to discuss their concerns about healthcare and ideas for ways to improve the situation here, participating in community activities, including the KPHD Data Summit in September, focus groups related to the community health assessment that's going to be released in late December, and the Johns Hopkins University report that's going to be available early next year. Finally, exploring the possibility of forming a public hospital district not to build a new hospital for the county, but to work with existing and new providers to ensure sustainable funding for high priority service gaps identified in the Community Health Needs Assessment published by Virginia Mason Franciscan Health, the Community Health Assessment from the Kitsap Public Health District, and also the Johns Hopkins report. And I would like to just piggyback on what the captain said a few minutes ago. It really is a burden for providers to be dependent on grants in order to get funding. What the public hospital district can do is it can become a source of sustainable funding. It can fund whatever programs are identified as being critical and necessary within the district. And a county-wide public hospital district at 35 cents per $1,000 of assessed value of property would generate nearly $23 million a year just on its own. And if that assessment was 40 cents, it would be up to over $25 million. So it's an amount of money that actually could make a difference in the community. Thanks very much.
All right. Well, thank you, Susan. Anne, do we have questions from the chat for this panel?
I do, thank you. So for Mayor Erickson, related to the Recovery Resource Center, there was a question around if you happen to be tracking where individuals are coming from who are seeking services.
Yeah, there's a lot of data gathering going on, and yes, we're tracking where they're coming from. It is mostly North End focused just because of, I think, logistics more than anything else. The partners are, as I said, the City of Bainbridge Island, and City of Paulsbo, working with the county through the Sheriff's Department. So it's pretty North End focused just because of logistics. It's pretty hard to get here from other parts of the county if you don't have transportation. They're being specifically referred by our municipal court and on the municipal court of Bainbridge Island. They're also being referred by local police departments. That is another way we're also just getting a lot of cold calls, people calling up and saying, I need help. But we are keeping data, understanding HIPAA requirements, et cetera. But I don't have the data here. Kim Hendrickson isn't on the call, so I can't access her. But yeah, we're keeping extensive data as to, we have to see if this is going to work. One of the things that the city does is it tries kind of new ideas. And we've done this in a lot of different arenas. And if they don't work, we don't continue. And so we're always gathering data when we start in a new process. One of the things we are finding out is that it's one thing to give people treatment for addiction or treatment for mental health, but if they don't have any place to live, we're sunk. So the next big push will be for what I call recovery housing, and where people can go and they can live there, not shelter there, actually live there while they seek treatment. And that's the next push.
Thank you. It's wonderful. We have two questions for Chief Gillard about the CARES program. One is, how do individuals access the program? Is it through 911 or, and is a police presence required at least initially? And then the second part is how much it costs annually and how much are you seeking in grants?
Sure. Access, for the most part, we've limited access to CARES through 911 referrals, as in these are folks that our firefighters are going to 911 calls, finding people who meet certain criteria with the type of call or multiple calls, and our firefighters will refer them to the CARES team or through law enforcement agencies. We've had some referrals through some of our partner agencies. One of the great things about the CARES team is they really don't have a silo they have to live in. So they've been able to make some just absolutely fantastic relationships with all the NGOs and other programs out there that are providing service. So they do take some referrals through those agencies, but most of it's through 911 referral. And the other part of your question was funding. Right now, the fire departments are funding the firefighter portion. Our CARES teams generally have two folks. One's been a social worker and the other one a firefighter. We have been getting grant funding for the social workers for the most part. And then the fire departments have been picking up the tab for the firefighter portion of it. So we've just received a grant for, I want to say about $50,000 through Kitsap County through the 1% diversion tax to help fund those social workers. We have another grant going through Salish that provides a forced social worker that Paul's was hosting that's really working as the program coordinator. But that ongoing funding is really the challenge for us. Is we're seeing the direct impact it's having. It's just a challenge from the fire department's perspective of every dime we take out of, we put into this kind of service, which is so meaningful and so helpful to the community, is a dime we don't have to fund emergency services. Did that answer all those questions?
You did. Thank you.
Okay.
Jim, is the 350 for just Poulsbo, or is it for Poulsbo and Central and South?
Thank you for asking that clarifying question. That's for all three agencies. And again, that's covering everything but the city of Bremerton, because Paul's was providing those services up to North Kitsap, the Kingston, Hansville area, and then to Bainbridge as well.
Well, Commissioner Rolfes, I think those were all of the questions submitted. Just checking one final time. Yep.
Okay, I saw there was a question to Mayor Erickson about housing and transit up at the Olympic College. And I want, Becky, do you have a brief response to that question? And then I want to call on Monica, and if we have time after Monica, Stacy from the county's aging division. So Becky, what do you
We
know?
have, up at BioOC, we have one large apartment building that's already built. And we have two more larger complexes that are under either in design, or one is in construction. And then, of course, it's within walking distance of what's called the Edward Rose project, which is 462 apartments. And so there will be housing. Now, if I were the college, I would look at building dormitory spaces. Dormitories are, I think, will be, there's land available for there, and that they actually are an important part of that college. And I think that that's a next step. I don't know if OC or Western will head in that direction. I think they should. Being a reformed CFO for a college, dormitories actually are a profit center for colleges. So I would imagine they will head in that way. But there's also, right now, there's housing up there around the college.
Okay, thank you. And can you promote Monica Bernard? I want to ask you if you have, I'm putting you on the spot because we have a couple minutes. Are there any new initiatives you want to share with us? Or just tell us everything's fine, you're coasting along, you just need more money?
Yeah. Well, you got that last part, but yeah, I mean, just very briefly, a couple of things. One is that Kitsap Mental Health Services recently became a certified community behavioral health center. What that means for us is a lot of things in getting us prepared for accreditation long-term, which will enable us to expand who we can serve. But it also means that we're philosophically trying to pivot out to the community more and making sure that our services are in line with what the community needs and where they need it. And so some examples of that might be the Salvation Army. We're moving, our intensive services team is working, partnering with the Salvation Army now. And that's just now starting, but it's trying to reach individuals who need that moderate to severe end of the spectrum. We're also expanding our youth day treatment program, and this is for kids that are really, if you think the 1% of all kids in schools across multiple school districts. who really need that support. Long term, we really want to expand that as an actual facility. And that's where the funding is probably requests will be coming down the pike. And then finally, this year, we also fully rolled out the mobile crisis outreach team and the youth mobile crisis outreach teams. Those are working very well. Our 24/7 services, historically, we've had some issues getting people into services, but our occupancy now is in the 80s to 90s. So we really, I think, are closing the gap on that as well.
Very good. Thank you. I know there's a lot more to talk about,
Yeah.
but it's nice to hear those highlights.
Great.
And Stacy, are you able, is there anything in the aging division that you think is worth sharing at this time? I'm sorry to put you on the spot.
No, no problem. Thank you so much for the invitation to share. So for introductions, my name is Stacy Smith. I'm the administrator with Kitsap County Division of Aging and Long-Term Care. We are a division under Kitsap County Human Services with the mission to work independently as well as through our community partnerships to promote the well-being and independence of older adults, adults with disabilities that live at home, and their caregivers. So excited to have the opportunity to share with you and to hear what is also happening in our community. I've taken a lot of great notes. From our perspective, we just like to remind the community that we are here to support our older adult community, as well as those adults who are disabled living at home and their caregivers. We are your tax dollars at work. Although I am with Kitsap County, we receive a majority of our funding through special revenue at the state legislative, as well as our federal levels. So we are those tax dollars that working people have invested in so that we are there to support them as they age in our community. Our number one thing, I was on a meeting earlier with some people on this call with our Franciscan, Mason Franciscan Health Partners, the hospitals. One of our newer programs is Care Transitions, where we are supporting people who have been admitted to our local hospitals and they're moving home and they just need a little bit of care coordination assistance. Maybe they need a home delivered meal. Our senior nutrition program is one of our largest programs, as well as our senior information and assistance. It's a free resource. We know we are the experts to resources that are available in our community. We wait for our phone to ring every day, so please give us a call. I would just want to leave with that. And it's super exciting. I just want to make a plug with what's happening on the north end of our county through those CARES programs. We are also supporting some of that work for fall prevention. This is individuals who have frequent falls or at risk of falling. We know that's the #1 leading cause to hospitalizations for our older adults. So we are working in partnership with our fire district up there. So thank you for the opportunity to just talk a little bit about the work we do to remind you that we are here for you and the people that we are serving. And if there's any questions, I'd love to answer those. Thank you.
Thank you, Stacy. I wanted the group to hear from you and what you were up to. Before we wrap this up, I want to see if anybody who remains on this call has anything that they want to share briefly with the group, so that if there's something that you think we need to know. There are a lot of people on here who could have been on the panel, but Anna and I carefully curated the topics so that we could move through and have things be somewhat related to the questions that we asked at the beginning. Joe Morrison from KETA raised his hand, and you want to move him in?
You might be able to hear me. Can you?
Hear you. Yep.
Oh, okay. Hi, everybody. I would just ask that as you have positive stories, everyone's aware of the focus on care and access to healthcare that this community is going through. So I would just ask that as you have positive stories or examples where your organization is really shining, that you share those with me. Our organization is going to be looking to share those publicly throughout 2024. So if you've got wins, if you've got successes, please reach out to me at KETA. Thanks.
Great. Randy Hartman had his hand up.
Yeah, good morning. I just wanted to give a brief update from Kaiser too. We've been working kind of feverishly behind the scenes. We've been able to hire and backfill eight positions, 8 primary care physicians this past year. So trying to help that need and keep the balance going so our patients aren't deflecting. We also have our kind of our own internal hospital at home program that we fund through our insurance program. And it's had some really great success early on too. So as you guys get rolling on that, I'm really excited to hear some of the stories going on with that as well. So
Great. Thank you very much for piping up. All right, not seeing any other hands. I will briefly run through what we see coming up in the next couple of months. So Anne has prepared a slide to make it just something we can all look at. The Johns Hopkins report will be presented to the Public Health Board in February. So following that will be, we anticipate will be a meeting for us to follow through, review recommendations, and define what role folks may want to play in implementing that. I will probably be asking Yolanda Fong from the Health District to take a stronger lead on coordinating this group at that time. So look forward to hearing more from our new public health director, Yolanda. And then 2 things coming up. I think at 1:30, the mental health planning group is meeting. So we're trying to get you guys out of here on time for that. There'll be a convening related to behavioral health services in our community and what we need, what we can amp up, what we need to expand. And then again, we heard a little bit today about how we as a community can continue to support the CARES programs countywide through sustainable funding. So a bunch of different things that we know are coming up. And again, Anne and I are always available to hear concerns and interests and see where we need to be going next. But I want to thank everyone for participating in this meeting today, for getting the updates, receiving the updates, and considering all the work that's been going on, and your commitment to continuing to work together to provide affordable, accessible, and equitable healthcare in our county. So thank you all. As Anne says in her slides, best wishes for a great new year, and thank you.
Thank you.